Okay, hello and welcome to my channel. It's Annalise Garrison, your NCLEX tutor. It has been about 6 months since I tutored anybody because I was planning on retiring from tutoring. Alright, I have a lot of stuff going on. I am taking my 30 years of tutoring and medical knowledge and putting it in a book. Alright. So look for that to be happening. I am working on a board game. I really want to make that happen. It's actually been 10 years in the making. I want to make that happen. What else? I have been volunteering for the Salvation Army for the last 6 months. And so I got a little carried away with the volunteering. And I'm like, I better get back here and tutor because I kind of miss you guys, So I've been updating all my information, all my next generation NCLEX is all updated. So since I'm writing a book, I want to make sure that the concepts are easily understandable. So I figured I'd do some more tutoring because people are calling me and saying, please, Miss Garrison, don't quit. We need you. so here I am. And I am also, on the fun side of life, I am also doing a Crafts for Hope Foundation. I actually want that to be a 501c charity, all right? So I'll tell you more about that as the as the days go by. As a matter of fact, I got so much other stuff to do other than tutoring that maybe I am going to have a self-care Saturday and share all this other information with you. The Salvation Army, the coloring book, not just the coloring book, the Crafts for Hope Foundation, the board game, the book that I'm writing. So look for a fun, if you want to look at a fun video, look for my self-care Saturdays, okay? But for right now, I want to talk about the next generation NCLEX and the 6 steps that they test with the critical judgment model. Sorry, not critical. That's critical thinking and clinical judgment model. All right. So let's talk about that. And I'm gonna pull up. I'll be using Next Generation NCLEX Test Items by Linda Ann Silvestri. Do not buy this book if I am tutoring you, because I can actually tell you everything that's in this book in 2 hours. But it is a good book. It was fine for those of us that didn't know what we were getting into. But now that the Next Generation NCLEX is a couple years old, we got this. So. All right, let's answer a question and I'll explain these 6 steps to you. Here we go. Okay, welcome back. I just, looked at the questions and actually did a practice question with somebody. And it took me an hour to go through it that way. So I will definitely save that for a tutoring session because I just want to make this video like a 15-minute video, okay? We'll see how long it actually is in the end. But I do want to just explain to you the 6 steps of the clinical judgment measurement model. Now, this is the way the NCLEX is testing on the NCLEX, and also your nursing instructors should be teaching you the care plans that way. But a lot of nursing instructors are not teaching the care plans using the clinical judgment model. So if your teacher did, but they kind of glossed over it, or you don't understand, I'm also helping people with their care plans. So if you need help with your care plans, contact me about them. But let's get into the clinical judgment model. There's 6 steps. Basically, the clinical judgment model has taken the place of the old nursing process, the old ADPI. Okay? So recognizing cues and analyzing cues has taken the place of assessment, okay, in the ADPI, the nursing process. Now, what is recognizing cues? Recognizing cues is simply being able to recognize what is wrong, whether your labs are off balance, your vital signs are off balance, anything wrong with the cardiac, the neuro, the integumentary system. Recognizing cues is simply just that, recognizing what is wrong. The second step, the analyzing cues, is being able to connect the dots, so to speak. Okay, this person is experiencing this and this and this. Start to connect the dots. Start to think why and how are these things related. When you start to think how and why are these things related, then you're going to start thinking about possible nursing diagnoses, okay? Sometimes the person might have more than one nursing diagnosis going on. They might have pain related to infection, as evidenced by thrombocytopenia, high risk for, something like this. And it might be all the same person. So when you start to connect the dots, when you start to analyze the cues, you start to think about nursing diagnoses in your head. So when you click the next button on your case study, sure enough, the third step is going to be prioritize hypothesis. Now, all that means is prioritize hypothesis has taken the place of the nursing diagnosis in your old care plan nursing process, right? So, prioritize hypothesis means you have already thought about your possible nursing diagnosis. Your nursing diagnosis is your hypothesis. Now, because you have 3 possible nursing diagnoses, what is the most important nursing diagnosis? Prioritize, right? So what is the most important nursing diagnosis? Prioritize, most important hypothesis, your nursing diagnosis. Isn't that simple? You guys already know this. You just don't realize you know it, right? And your teachers, like I said, your teachers should be doing the same thing with your care plans. If you need help with the care plans, call me. If you need a resume, call me. If you need a cover letter, call me. But let's get back to the 4th step. What is the 4th step in the clinical judgment measurement model? That is generating solutions. What does that mean, generating solutions? Well, guys, that's just a fancy name for plan of care. So in your ADPI nursing process, P, plan of care, now is generate solutions. So you want to stick with the solutions of that nursing diagnosis that you recognized in the 3rd question, okay? You want to stay with the plan of that nursing diagnosis, all right, depending on your question, okay? The 5th step is take action. That's self-explanatory. It takes the place of interventions in your ADPI nursing process. What is interventions? It is now take action. What is action? What is the nurse going to do? What are you going to do for the patient experiencing a tonsillitis or whatever the scenario is? Make sure you stay with your patient's diagnosis. Don't put anything, don't add extra. Don't take anything out. And then the sixth step of your clinical judgment measurement model is evaluate outcomes in the old nursing process. ADPI, it used to be evaluate or evaluations, right? So now there is 6 steps to the clinical judgment measurement model, and that's what the NCLEX test in this order whenever you get a unfolding case study. When you get an unfolding case study, all 6 of these steps are tested. There are standalone case studies on the NCLEX, and there are single case studies, which I will cover also when we tutor. So if you need tutoring, make sure you call me today. The number is on your screen in the intro, and it is in the description, guys. I have had a 100% passing rate with the nurses that I tutor, and I personally like the new NCLEX. I like the next generation. It makes you think, it makes you look at the chart, but you have to be good with critical thinking, guys. You have to be able to critically think, and that is what I'm going to help you with when I tutor you. Okay? I'm going to help you with the critical thinking part. Like I said, if you are doing care plans in school and your teachers are not using this model, the clinical judgment model, for your care plans, they really should be. All right? If they are, but it doesn't quite make sense, contact me. I'll help you. All right. God bless, and I'll see you in the next video.